goal of the conference will be, how do we get the message out to our healthcare professionals that they are responsible and they are integral to changing the landscape for the adolescent young adult cancer patient. This conference really was about putting the psychosocial aspects in the center and building on the preservation of fertility, and that preservation of fertility and how that meant to the cancer patient.
The flip side are the doctors, is the medical community, the oncologists that are out there every day saving our lives. They need to be made aware just as much as we are being made aware that we have the right to survive, but we need to respect that they have to grow within their industry. And I think what the Society for Adolescent and Young Adult Oncology is doing is really redefining and differentiating and even disrupting the system that we have the right to think differently and behave differently and talk differently about the change we want.
I was really impressed by the brilliance of the speakers and their warmth and passion, and we hope they move the ball forward as it relates to teen and young adult cancer issues. Really terrific.
So I've really relished the opportunity of being able to speak, but also to meet so many great people who are so enthusiastic, and some brilliant advocates as well.
I am loving this conference. It's bringing awareness to the community and about adolescent and young adult oncology, and we've got a long way to go before we can make the strides that we need to when it comes to improving survival and outcome for this group of patients.
What we're presenting at this conference is that we've developed an app for AYA leukemia to help remove the barrier of complexity for doctors who want to treat with these AYA protocols. So you can choose the day of each course of the regimen, you can choose the drug, it'll give you specific information about that drug. So by developing the app, we hope to remove that barrier of complexity and allow more AYA patients to be treated with the appropriate regimens and the most effective regimens and get the best outcomes.
CHOC really wants to have this program excel. Some of the presenters today have really highlight some key components that I know I can take back to our nursing staff and try to get them more knowledgeable in the same areas, and hopefully maybe even bring some of those people back to talk to our nurses individually.
This Society for Adolescent and Young Adult Oncology meeting is important because it's bringing together thought leaders, it's bringing together clinicians, people who really care about this population and want to come to solutions for how we can improve care. People with cancer, they're a whole person, they're not just a disease. And you need the input from all these people and their perspectives, and that's what we've got here.
It's just great to know that there are people out there who have dedicated their lives and are working towards, finding more cures, doing more research, providing more services for this AYA population.
And just the fact that there actually is now a society for young adults is extraordinary in the annals of oncology history. For someone like me who wished it existed 18 years ago, it's here now. And it's a result of the change that we've been pushing forward. And I couldn't be happier to be a survivor more than ever today.
This is the first, and it can only get better. So thank you for all of you who came. And please join the society, read the journal. We can change how adolescents and young adults are treated in this country.